Welcome to Better.Do Better, presented by RX Physical Therapy, where we talk to local healthcare and fitness professionals about all things injury, recovery, health, fitness, and training. Today's episode, I sat down with Dr. Olga Koza, who is a physical therapist who specializes in pelvic health. She works a lot with women who are prepartum and postpartum. This was a great conversation. I feel like I learned a ton and was exposed to an entire world that I really didn't know existed. So I hope this episode resonates with you guys and you learn a few things as well. Did you start at the hospital? Like, how did you start your career?
Oh, no. So I started working as a ortho outpatient.
Okay.
Yeah, at sports care. I don't know if I can say that.
You can say whatever you want. It's all good, yeah.
But I was introduced to PT back in high school. So I guess I was an athlete, right? I swam, I danced, I played soccer, did all those. And then I worked for a local chiro who had a PT acupuncturist and himself in the office. And that's how I got introduced to PT. Fell in love with it. I was like, wow, this guy's actually helping people and not drugging them up. It was the best thing ever. And had that really nice relationship with them. And in school, I was like really interested with pelvic floor PT. Mm-hmm. So I did a couple of shadowings, but it was like all very acute inpatient. So I didn't fall in love with it. So I went the outpatient route. So I ended up at sports care, big orthopedic outpatient. And that kind of led me to get my manual certification to kind of understand the human body, right? Like I really wanted to understand how to move and I guess treat people the way I thought they needed to be treated, right? I didn't think there was like a cookie cutter way of doing it. So then with sports care, I stayed there for a couple of years. After I had my babies, I went back and I realized that there was like a huge disparity in women's health. And I was like, this is terrible. Like, cause I had complications on my own, like, and no one was able to help me until I kind of figured out, okay, I have to go see a pelvic floor therapist. This is what's going on. And yeah, so I treated myself. I found somebody and then I was like, I'm going to do this. I'm going to do this for everybody that I know. And I started treating while I was there, but given the fact that they were so big and most of those outpatient places aren't able to see one-to-one, they weren't able to give me what I needed to do the right thing. Mm-hmm. So then June of 2021, I opened Optimal Movement, and I've been there ever since.
Oh, that's awesome.
Yeah.
You're just like me. You're a pandemic business.
I am.
Right?
Absolutely.
So when you were inpatient, the acute inpatient, like I didn't realize that was a thing for pelvic floor.
They do
Were you looking at like post-op kind of stuff?
So we were looking at everything, but I was looking mostly for stress and urinary incontinence, a lot of pelvic pain patients. Mm-hmm. Anybody that they kind of didn't know what to do with, they're like, okay, let's see if pelvic floor PT will help. And so
it was inpatient?
It was inpatient.
Okay.
So it was like I remember at one of the hospitals, it was like a hallway closet that the therapist had like one treatment table. And she just had their like patient after patient, only biofeedback, internal exams, and like no movement-based things. So I was like, okay, well, I thought it was going to be different. And then, fast forward a couple of years later, I kind of figured out, oh no, they were doing what they thought they were doing the right way, but you could do it better. Mm-hmm. And that's how I came about.
Wow, that's really cool. What was it that like you fell in love with? Like, what about it, about pelvic floor health?
I think a few things. I like things that aren't very well known. So I was like, this is a great area and it kind of connects to everything, how we breathe, how we stand. And it translates to even like when I had patients as a regular, orthotherapist, I was like, why isn't their hip and back pain getting better? And I was like, there's something going on that I can't palpate, that I can't reproduce, right? Because that's what we do. We reproduce the pain to kind of figure out where it's coming from. And then after I learned about pelvic floor, I was like, oh, look, obturator internus refers to SI pain instantaneously, or that labral pain that patients had that we're getting surgery for that would never helped, but now I just helped them. Mm-hmm. They're like, oh, that's my pain I've had for the last 7 years. I was like, well, there you go. This is what we could do for it.
I love hearing that.
Yeah.
I always look at the body as like a puzzle as well. So like the more ways that you can attack the puzzle, the better your outcomes are going to be.
Absolutely. I find myself like every day I'm a detective. When I have a patient come through, especially for evals, my goal is to figure out where it's coming from, right? Because we all know, if like when you're a clinician, that the pain isn't just because you have pain on your elbow. It's because, right, your shoulder, your thoracic spine, something is going on, right? We have to figure it out. And that's same thing with the pelvic floor. It's just a huge muscle that's been bypassed for all these years.
So what you just said, any of my patients that are listening to this right now, they're going to be like, oh, that's what he said. Like, he's, there's more than one person who thinks like that. Okay.
Yes.
Like, he's not crazy. So
not crazy.
You know who you are, and you're right. Yeah, I kind of lost my train of thought there, though. But, like, what does, like, a typical treatment session look like, then, if you're treating somebody? And, like, what are a lot of the really, like, common problems that you run into?
So right now, I guess it's not by default, but you gravitate to the things that you're experiencing. So I'm a young mom, right? So a lot of my patients are pre and postpartum. But a typical session goes with, I do full 90-minute eval, right? So I do a full orthopedic screen. We look at breathing, posture, squatting form, your, hip and lower extremity mobility, thoracic mobility, everything like that you do. And then in conjunction with that, I couple it with the internal part of the pelvic floor exam. So we palpate the musculature inside, your strength, but most importantly, how well you're able to relax and if you're able to connect. Many times women, like, especially the postpartum moms, they come in like crying. They're like, I just want to run after my child without thinking something's going to fall out. Like, my insides aren't going to fall out. And I'm like, no, we can help this. It's not. And a lot of it is education, because what we think is happening in our body might not be exactly what's happening. And I'm there to kind of like guide them, be like, no, it's okay. Like, you're feeling this because of this. I'm able to correlate the two together and then just calm them down about it. That's like the very first session. A lot of it is education. I give them like simple treatment techniques. A lot of times I teach people how to breathe. A lot of it is breathing, proper alignment, ribs and pelvis. And then the best and be all when I love is teaching how somebody connect to their pelvic floor and their core. A lot of times I have patients coming in, they're like, I've done Pilates so many years. I was like, great, this is amazing. And then when I show them, I'm like, okay, now show me how you're able to do a brace. They brace, but they recruit obturator, like external obliques, internal rectus, everything is firing. I was like, well, this is why this is happening. You're not doing it all the way. They're missing that key component of the deep pelvic floor. And then once they're able to connect, their symptoms truly resolve. Yeah, so it's great.
It's got to be such an emotional journey for you and the patient.
100%. I feel when my patients graduate, they're like, thank you so much for helping. Thank you for getting me back to like functioning, right? And not feeling as if I'm falling apart. Because a lot of women do. They feel as if like after they have their babies, they're like, I'm done. My body's shot. And I'm like, no, this is like a great time for you. You could be better. You could be stronger than you were before. You just have to learn how to do it again. Yeah.
What's the conversation like when you tell people like, hey, all right, we're going to palpate inside? Like,
yeah, absolutely.
Are you ready?
I think a lot of them are, sometimes they're like, yeah, do whatever you want. I've had babies. I'm good with it. Or other times women are like, they're hesitant about it. But then I feel as if like I try to make them feel so comfortable prior. They're like, okay, it's just another part of the exam. And then I have a nice pelvic floor model, right? So I show them exactly what we're going to do. I show them what muscles I'm palpating. I have diagrams around my room and be like, okay, so you see what I'm feeling here? This is that muscle. And they see it on the chart. Mm-hmm. And they're like, oh, I understand. I'm like, and do you see where it connects to that sacrum? Do you see where it connects to this bone? That's why you're having that pain. And once they're able to kind of connect it, they let me do whatever I need to do to make them feel better, because they're like immediately feel an improvement, whether they're having pain, whether they're having stress, incontinence, urinary urgency, constipation, all those things. When we do certain techniques, they feel it for the next visit. They feel the difference.
That's great. And I assume there's some sort of like draping and all of that to like help people feel very, very comfortable.
Absolutely. It's not like a traditional setup where you go to the OB office where you think you're like spread out. Mm-hmm. drape them comfortably. You're set with pillows. You're all nice and relaxed. I have a massage warmer on my bed, so it's nice and warm. A blanket, playing music.
Oh, it
Very nice.
Actually, sounds like a really good experience.
Very relaxing.
So you like to work with moms who are about to be and new moms. Do you run the gambit on the age spectrum as well?
Absolutely, yeah. So I treat everybody. Like I right currently on caseload. I have a 92-year-old. So
God, yeah.
Yes, she's amazing. So yeah, all the gamuts, peripause, menopause, any of those types of symptoms, because women come in with different types of problems later down in the road. And then you can't forget kids. I don't typically treat children, but pelvic floor also stems with a lot of children, where if you have bedwetting at night, where you have chronic constipation, those are all things that can be addressed by a pelvic floor therapist. And no internals involved. A lot of behavioral strategies, a lot of like movement techniques, just for the child to understand, hey, this is how you go to the bathroom. I use it on my 4-year-old all the time. Be like, blow out your candles and use your squatty potty when you go to the bathroom.
That's so funny.
And he knows.
Yeah. I never would have thought about like pelvic floor techniques for a kid.
Absolutely. Yeah. So it encompasses all. Not only, everybody has a pelvis. Every human has a pelvis. So pelvic floor PT is for everyone.
Yeah.
Yeah.
I mean, I can see how much of a benefit it can be, being like a missing puzzle piece, like 100%. The more you're talking, the more it's got me thinking about like certain people, and different types of things. But I always try to ask like screening questions. I don't do any sort of pelvic floor, but I always, any issues going to the bathroom, either way. And if you do, like, it's always good to have somebody who can actually help with that, because that's not really my area at all.
Yeah.
Yeah.
There are definitely screening tools you could use, where you could just give, like, especially in the regular outpatient setting, you could just slip it into the form, and it's a nice quick questionnaire, and you could see whether or not the patient would qualify for a pelvic floor PT.
Oh, that's actually a great idea. I might actually
Cozine screen, it's called.
I might steal that. Update my intake forms.
Yeah.
So do you do any sort of like strength training with them as they
progress? Yeah. Absolutely. Yeah. So typically when a patient comes on, my goal for them is to be able to run without leaking, be able to squat without leaking or having any kind of pelvic floor dysfunction, or vice versa, or like, if they have chronic constipation, any of those. So any of the symptoms that they come through with, I want to discharge them without those symptoms in conjunction with functional living. So every woman has to be able to run after their toddler, regardless, right? Sprinting. And so yeah, that's where we kind of do.
That's all.
That's what I try to do. Yeah, I transition them to jumping, running techniques, squatting techniques, depending on where they are athletically. I leave them there. Yeah.
That's awesome.
Yeah.
We see a lot of CrossFitters have issues with double unders.
Yes.
A lot of power lifters issues with deadlifting.
Yes.
I hate to see those videos on Instagram as
normal,
but more as like trophies. Like, I hate it being glorified, because 100%. it's such a negative thing, and the more that gets posted, the more it normalizes it in the wrong direction.
100%. And that should never happen. I understand if you're deadlifting 500-600 pounds, that's different, right? But if you're deadlifting smaller amounts, there should never be any incontinence with it. Yeah. That means that the technique is wrong, your pressure systems are incorrect, and you're only doing more harm to the system the more you do it, right? Because you're lengthening in the wrong direction. So prolapse, rectal prolapses, vaginal prolapses, all those things happen. Incontinence happens not only with not only the leakage happens, everything else happens. So not good.
Yeah, I imagine the leakage.
Hernias.
Yeah. Oh, God.
You don't want any of that.
Is leakage kind of like a precursor for some of those more intense things like prolapse?
No, not necessarily. No. Prolapse is it could be a genetic component of connective tissue, right? Because if you are a female who is of lighter skin and has collagen fibers aren't as firm compared to other ethnicities, then you are at a higher predisposition of prolapse. But if you are having just stress incontinence, a lot of times stress incontinence is because we're too tight, not because we're too weak. So we have to lengthen, and yeah. So yeah, no, not necessarily. Those two don't usually correlate with one another.
Oh, okay.
Prolapse will cause leakage if you actually physically have a prolapse.
Gotcha.
Because of the anatomical aspect of how it pushes onto the bladder.
Gotcha. Yeah, things can't work the way that they're
Correct,
supposed to.
yeah.
Yeah. Okay. So I imagine you've been in contact or been around a lot of other pelvic floor therapists or other physical therapists in general. What would you say is kind of unique about your approach to either orthopedic physical therapy or pelvic health, pelvic floor physical therapy? What's unique about what you do in your practice?
Oh, absolutely. So I want to, and I do, I blend both worlds together. I don't consider myself only a pelvic floor therapist, right? Because I see the person as a human. So if my patient comes in and they have neck dysfunction, I'm going to treat that. Mm-hmm. And then we're going to address the pelvic floor dysfunction as well. So I try to merge both worlds together because the pelvis is connected to the rest of the body. Mm-hmm. So yeah, I definitely try to and want to have people understand that you could get both in one, right? Because we kind of just link it together. So in my practice, I try linking them together. And I also like the holistic approach. I truly believe on a person's psyche, how, the way that they speak about themselves, about the world, about the energy that they produce, just their gut biome, the vitamins they're taking, the sleep they're getting, all that is all in one. So that holistic approach as well. I try to kind of encompass all in one.
Yeah. You mentioned like supplements and things like that. Do you see any sort of like correlation with like any sort of supplements or like dietary things that people are doing that predispose them to some pelvic health issues or urinary issues?
Absolutely. So if you have, depending on the type of vitamins you're taking, you could cause acidity in the bladder, which cause you to have urgency. So things like that, or if you're taking a supplement. I just had a patient the other day that was taking a supplement just to give her energy throughout the day, and she had no idea there was stevia inside of it. And I was like, well, stevia is a huge bladder irritant, right? It's a sweetener. And she's like, oh, and I was like, that's most likely one of the main causes of why you're having urgency. And she had no idea. So a lot of those things, yes, supplements and those, I guess, energy drinks or any of those things, that will correlate with it. So when you come to a pelvic floor therapist, we typically have you also fill out a diary for 3 days of what you're eating and how much you're expelling. That way we kind of see the trends and see what could be irritating you specifically.
Oh, okay. What are some of the other like bladder irritants? Because I've seen things like seltzer as a potential
carbonated drinks, right? But that's usually lower on the category. The biggest triggers I find are caffeine, dairy products, and acidic foods. So grapefruits, oranges, lemons, limes, strawberries, any of those things, and artificial sweeteners are huge. And a lot of people do it, and they don't even know where it's snuck in sometimes into the foods and to the drinks that they're eating and drinking.
Yeah, it really forces people to start looking at the labels again. But like way differently.
Absolutely. Yeah.
Very, very often I have people saying, oh, this is this many calories or this many calories. Instead, I feel like they should be looking, this has this much sugar. Like, how many of these ingredients can I pronounce?
Exactly.
If there's any that you can't, maybe don't eat or drink that.
Please. We don't eat
that. Whole foods, water. Just drink a lot of water.
Yeah, speaking of water, sometimes people are like, I try not to drink at all. And I was like, well, that's why you have such urgency, because if you're not drinking enough water, you become acidic. Your bladder becomes acidic and it makes you want to go more. So people tend to kind of stay away from the water and drinking versus you need to do it more. Use it. Like you have to be well hydrated. Mm-hmm. So yeah.
It's just a general rule for life. Be well hydrated. You're going to perform better.
Because you're going to get a lot of complications from it.
Yeah, I can imagine if people are having some urinary issues, they'll try to stay away from water so 100%. That they don't pee. That's got to be a tough education piece for you. Or like a tough buy-in piece for people.
Absolutely. Or the just in case peeing. I have to battle that up the road every day. Mm-hmm. Like where I'm just going to go in case I can't stop. And then I have to tell them, like, no, you have 3 to 4 hour window periods where you don't have to go to the bathroom. So plan accordingly, and then you could stop yourself. That is a behavioral trait that you just have to defy. Going to the bathroom at night, it's a huge. Moms go to the bathroom every time the baby gets up. The baby stops, they probably sleep through the night, 9-10 months, whatever your baby is. The mom still wakes up 2-3 times a night to go to the bathroom. Well, that's a behavioral change. You fix it. It's not that there's anything wrong with your bladder. It's just you have to reteach it to be like, okay, no, I'm able to hold it 8 hours overnight. I'm sleeping now.
Is that something that you attack in the daytime, or like how do you get them not to?
So it's daytime habits reflect nighttime. Yeah. So we want to have them on a good schedule during the day, and then as you get better and you're well hydrated, your vitamins are in check, everything's going well, your nighttime habits will be better as well. You'll notice a significant improvement within a week or two after you're staying consistent with everything that we go over.
Oh, that's awesome. Do you give them like a worksheet to fill
100%.
out? 100%.
They get a diary there before their eval to fill out for me. So like 2-3 or like usually about 2 or 3 days worth, and then an extensive follow-up email about their visit, what we went over, because I spew so much information at them, so they understand like what their homework is and what we're attacking. Typically you want to attack urgency, that like I gotta go to the bathroom, I can't like open the door without wanting to pee myself first. And then we address the stress incontinence, the sneezing, the peeing when you sneeze, the laughing, those kinds of things. That's like a different kind of incontinence, so we attack that secondly. But your urgency is typically easily addressed by behavioral changes.
So I've seen in maybe just on the internet and different types of camps surrounding pelvic floor health. Where do you stand on things like absorbent pads as a means to treat instead of like pelvic health, or like do you use it as like a in between, a go between, like a short term solution, or do you know what I'm talking about?
Yeah, I like absorbent pads in regards to like if you have leakage and this is what you're gonna do.
Right.
No, I don't think anyone should be incontinent.
Yeah.
I don't no. I recommend products to get us to the point so you don't have any infections, absolutely, right? To get us where we need to be. But in the end, all that pad should be dry, right? You're young, you're physical, you're functional, you have good health. There's no reason why you should be incontinent. Yeah.
I mean, that kind of says it all,
Yeah.
you know? That's kind of what I had thought when I was looking at it as well. I kind of hemmed and hawed, I guess, making my opinion. Like, you know, maybe you can use it as a quick short-term go-between while you're getting
Absolutely.
treatment.
Yeah. So they have a lot of products like that, right? Especially for long-distance athletes, runners. Mm-hmm. They do. But get yourself to a pelvic floor therapist.
Exactly.
That's what you want to be at. Like, if you need to use the product, 100%. But that's not the norm. Yeah. That shouldn't be the norm.
It's like orthotics. They should be a very short-term
solution.
Yeah.
Use your feet. Yeah, that's another thing we work on. Foot mobility, first toe mobility, learning how to splay. I teach people how to weight bear through their feet, right? 3 points of contact. Oh, really? Like, yes, you don't push through your heel. Like, you gotta use your whole foot.
Yep, the whole foot. Yeah. Get some shoes that have a wide toe box.
Thank you.
Stop walking in heels.
I have everybody get toe splayers every time.
Yeah, I've actually got a set on my desk right there that you can see.
It's good.
I was talking to somebody yesterday, and this morning she sent me a picture in her toe separators, and then like 2 hours later she sent me a picture in her brand new Ultra running shoes. Awesome. And it was like it made my morning.
Absolutely.
So I was like so excited to see that.
Right. That they're listening.
Yeah, they might be. And I hope they know that I'm talking about them. And I'm proud of you, so congratulations. But one thing I always like to ask, and I feel like I've learned so much today in a world that I really didn't know much about, but what's something that you wish everybody knew about what it is that you do, or like from the profession that you work in?
Okay, whatever. I would, that it's not normal to pee. Right, when you sneeze, cough, run, that is not a norm. And what else? I don't know. I feel as if that it's not only about the pelvic floor. We address the whole body. So I think a lot of people get thrown off that we do internals, we do all that stuff, but it's a lot more than that. And yeah, we could help address all sorts of dysfunctions, not just the pelvic floor.
Yeah, I absolutely
We couple it together with it.
Yeah, one thing I always like to say is common isn't the same as normal.
Correct.
And I feel like you're kind of driving that home. You know, just because it happens a lot doesn't mean it should be happening.
That's 100% right. Yes. Yeah. And everyone should get, I know I'm going to like get on my soapbox, but as a female, I think pelvic floor therapy should be a standard of care, especially after you have babies. I think you have a 6-week OBG post-op visit, right? You should have a 6-week pelvic floor PT visit. So they tell you, okay, you're able to contract and relax the right way. All right, we'll release you to running. We'll go over things to kind of see if your hips and your pelvis is moving the right way, if you're contracting the right way. All those things, so you don't go free balling and like, hey, I'm gonna go run for 1.5 miles, 7 weeks postpartum. I'm gonna go with a no.
Yeah.
Right?
It's gonna be a no for me, dog. Yeah. So I feel like a lot of women get frazzled, and rightfully so. At that appointment, they have so much going on. They're probably not sleeping,
right,
whatever.
Exactly.
But what are some ways that they can advocate for themselves in order to, get those types of services? I feel like far too often you hear people like talk about it or ask about it, and the physician will be like, "No, you don't need it."
Right.
What are some things people can do? Questions they can ask?
Absolutely. Well, you could ask the physician, right, if they checked your pelvic floor strength, then guarantee they're going to say no, because they don't even know how to most of the time, right? But the beauty about PT is we're direct access, and you don't need a script. You could come in without anything to me, and we're primary care physicians, so I'm able, if there's something wrong, I'm able to refer you out if I can't handle it, or if we find something that's abnormal and that we need to get looked at. But no, come in. You don't need a script. Absolutely.
That's the beauty of direct access right
Yeah.
there. Thank you so much for coming in. Like I said, I feel like I learned so much. You mentioned direct access. So can you tell everybody, if they're interested in learning more about your practice, what you do, where can they find you? How can they get in touch with you?
Absolutely. So my practice name is Optimal Movement Physical Therapy. I'm located in Pompton Plains, New Jersey. You could either email me through the website or go through my Instagram, which is upmovementpt.com. Well, without my handle. Yeah.
All right. Thank you so much.
Thanks.